Susan Myers is the Alachua County Community Support Services Director. Her first experience with county government came when, as an undergraduate student at the University of Florida, she volunteered at the Alachua County Crisis Center. As a graduate student, she did an internship at the Sexual and Physical Abuse Resource Center, or SPARC, which is now Peaceful Paths. She was later hired by SPARC as the shelter manager. After graduate school, Susan worked at the Rape Crisis Center in Washington, D.C. as the Community Education Director. She began her career with Alachua County in 1993 when she was hired as the Metamorphosis Program Manager. Metamorphosis is a 21-bed residential substance abuse program. While there, she became a certified addiction professional. In 2001, Susan transferred to the Alachua County Community Support Services Department as the Social Services Division Director, and she was responsible for administering the county's homeless prevention and health care programs. In 2005, she was promoted to the Assistant Director of Community Support Services. After 15 years, Susan left Alachua County to work for both Broward County, Florida, and Multnomah County, Oregon, as the Human Services Department Director. These counties provided the same broad level of services, only on a much larger scale. In 2014, Susan returned to Alachua County as Director of the Alachua County Department of Community Support Services. Susan has a bachelor's degree in psychology and a master's in education. She also holds a specialist in education certificate, a specialty in community mental health counseling, and a certificate in public administration. She is a member and secretary of the Florida Association of County Service Administrators and a member of the National Association of County Service Administrators. Welcome, Susan.
Thank you, Mark. I appreciate the invitation.
So, Community Support Services is a very important department of the county. Some people don't know that we are kind of charged by the state of Florida. Counties are charged to be the social services and community services providers. Tell us some broad information. For example, what is your budget? How many people work there? Those types of things.
We have a budget of about $13.5 million, and we have right now 43 staff, including myself. We recently had a reorganization, and the Ag Extension Office is now a standalone entity, so that has reduced our budget somewhat. Go ahead.
Where does your funding come from? Is it a variety of sources?
About $11.5 million of our budget is county general fund, and $2 million is grants. We have some grants in our sexual assault and rape crisis center division, and we have our foster grandparent grant. So about 11.5 is general fund.
And so many important divisions within your department. I want to jump right into them because I want to give them the attention they deserve. The Crisis Center, tell us about the operation of that division.
The Crisis Center has been providing services in this community for 40 years, and it provides crisis intervention and prevention services. We have a 24-hour hotline, crisis intervention hotline. We are the county's mobile outreach unit, which means whenever there is a significant mental health crisis somebody's experiencing in our community, particularly if law enforcement is involved, we are called and we go out and we assist law enforcement with that situation. It could be a suicide, it could be a mental health crisis, could be an attempted suicide, whatever it is, we are there to help. The Crisis Center also provides some other needed services. We do free counseling in our offices. We do individual, group, and family counseling. We have a significant partnership with the University of Florida, the College of Education, the College of Psychology, and we have interns who are performing the counseling. And we also have 120 volunteers who actually provide the services. That's the only way we could get this job done, is with those volunteers.
I was interested, I did not know this, but your first volunteer opportunity with the county was at the Crisis Center?
It was. I worked on those hotlines way back when, before I even went to graduate school.
Also, my area, communications, works closely with the Crisis Center when we're mobilized in an emergency. I know they become the rumor control line.
Yes, actually the rumor control line it developed during the student murders that we experienced here many decades ago, and it has lasted throughout because being a university town, we have parents throughout the state, throughout the country, and when there's an event here, they want to know how it's going, how are their kids, and it just sort of grew into a community-wide service. And yes, we are the rumor control hotline, particularly during any event, hurricane, and so on.
And you can reach that during an emergency by just calling 311.
Yes.
That automatically goes over.
Simple.
Victim Services and the Rape Crisis Center.
Victim Services and Rape Crisis Center, we are a certified rape crisis center, and we became a certified rape crisis center several years ago to get some grant funding. And we serve all victims of crime, sexual assault, as well as aggravated assaults. We serve family members who have lost somebody to homicide. We provide advocacy. We also have a 24-hour hotline. We work with families and victims throughout the legal process. We provide counseling. And one thing that's unique about our Victim Services and Rape Crisis Center versus some of the other ones is that you do not have to press charges to get services. We work with many people who were victimized as children, who were victimized as young adults. They never press charges, but they are still struggling with the aftermath of that experience, and we provide individual and group counseling and sometimes family counseling for those victims.
Can you kind of walk me through the process? A crime is committed, there is a victim. Do you all work directly with law enforcement, or how do you become engaged in the process?
A little of both. We have 2 counselors outstationed at GPD. Actually, they give us some grant money for that. And so, yes, we do a little of both. We work directly with law enforcement. We'll get a call. We have staff who go to the emergency rooms to be right in there with victims. And we get referrals sometimes from the state attorney's office in terms of clientele who come and see them. So it's a little bit of both. We get just people who voluntarily call us in crisis.
With your law enforcement relationship, is it something that the victim requests, or do you respond automatically and kind of give them the option of having your services? Or?
Yes. Yes and yes.
Yes.
Sometimes they request. Sometimes we do get a call from law enforcement, and we are there just as an advocate, as a support, and they frequently follow through for more services, and sometimes just us being there at that extreme moment of crisis is enough. It really is individual, person to person.
I know that we've been involved with that division from an educational point of view. I know that there is a lot of outreach to the public on, what to do if you're a victim or how to avoid becoming a victim. So that's a very important component as well.
Actually, I didn't touch on this with the Crisis Center, but both with the Crisis Center and Victim Services, we have a large component of community outreach, community awareness, training. Victim Services and Rape Crisis Center staff, we go to the public school system and do a lot of prevention activities, respect your date. With the Crisis Center, we have what we call crisis intervention training with law enforcement. We are a significant component of that. We work with all the various law enforcement agencies and 911 staff to help them learn how to deal with people in mental health crises and so on.
I went through an exercise when I was preparing for this, and I just Googled suicide prevention. And if I added Alachua County, that division came right up. If I didn't add that, a national hotline came up. And when you go to that site or call that number, you just tell them where you are, and they immediately directed us to the crisis center. So
we do have a contract with the national hotline, and we are the service provider for them. And we do a lot of suicide prevention trainings. We actually have a significant relationship with the University of Florida, and with the public school system, because there is an increase in suicide among young people, and we do our best to educate, make people aware, and try to prevent that as much as we can.
I know you also have an amazing Veterans Services office.
Yes, we do.
In your department. We have had great folks come in and out of that department over the years, and we have a very active veterans community that we've had the privilege of working with on a Veterans Memorial publication a couple times. But tell us about Veterans Services and what you have to offer Alachua County veterans.
Veteran Services, almost every county in the state has a Veteran Services office. I like to think that we have one of the best. And what we do is we help veterans and their families go through the benefit process so they can get the benefits that they are deserving, that they are entitled to. And it's a lengthy, complicated process, and it really does require some advocacy, and so that's what we do. We work with our veterans in this community, all ages, from newly arrived vets from some of the Middle East campaigns to still plenty of Vietnam vets, Korean vets, and so on, World War II vets. We work with their families as well. Last year, we helped bring in $2.7 million of benefits into Alachua County through our veterans. So we do, and I think our staff do an amazing job working with that population.
I've had the privilege of hearing some of the stories, people that have had a very, very difficult time and finding success and getting the benefits they deserve by working with our department. It's such heartwarming stories. I know that they're also, Veterans Services is also very involved with the Memorial Day and Veterans Day and some of the great celebrations that take place.
And that's where we work very actively with our advisory board. There's a wide array of veteran service organizations represented on the Board of County Commissioners Advisory Board, and they really work hard to make those events a success. They work in the public school systems to educate kids about veterans, and they're just also great fun. The Veterans Day event has parachutists, and you know, it's always a nice event for everybody in the community, young and old, veterans, non-veterans, everybody loves it.
I know we have the Veterans Stand Down event coming up. That's an annual event, and this year it's being held on 9/11.
Yes.
Unfortunately, a large percentage of our homeless population are veterans. Can you tell us a little bit about that event?
That is an event that's going to be at MLK, as you said, on 9/11. It's an event where there's a wide array of services available to veterans. They come to the MLK Center. They can look for jobs. They can hopefully look for affordable housing. They can get a haircut. They can get toiletry supplies, clothing. There's all kinds of people there wanting and willing and ready to help our veterans and our homeless veterans.
You are also, your department also oversees our social services area, and I know that's a particularly important division for folks in Alachua County, particularly folks that need a hand. Tell us about social services, what's provided there.
As you know, we have a homelessness problem in our community, as we do across the country. And some of the programs that we have in social services are to prevent homelessness. So we have a rent utility assistance program where people can come in, and if they are having difficulty paying their rent or their mortgage or their utility bill, there's eligibility criteria.
Right.
And if they're eligible, they can receive assistance for a month of housing. We want people to stay in the housing that they're in. Sometimes people lose their jobs. Sometimes people have a health care problem and they're unable to work for reasons beyond their control.
And it is a great advantage to keep somebody from becoming homeless to begin with.
Yes, and especially when there are children, small children involved. So we have our rent utility assistance program, which is a very popular program. And then we also have some healthcare programs. We have a contract with the health department, the public health department, where we assist people get primary care, primary health care, as well as prescription assistance, which is very important because sometimes when people have health care issues, they can't work. And our goal is to get people working, get people employed, and get people staying in their homes.
Some people don't understand that the State Health Department Alachua County branch is located in the same complex as you.
Correct.
And we actually provide them funding to do enhanced services over and above what they would normally do as the State Health Department.
That is correct. The state statutes suggest that counties have a close partnership with the health departments, and Alachua County, we provide almost $1 million to the health department. I think it's $940,000, and that assists them with the primary care services that they provide, as well as the environmental services and the communicable diseases that they provide. But we have a strong partnership with the health department. We always have. We often have co-located with them, and we see a lot of the same clientele.
Now, that social services is also where the indigent burial program happens, is that correct?
That is a state mandate that counties bury and or cremate indigent individuals, and that's almost a $100,000 budget, about $92,000 I think. This county prefers cremation. It is less expensive. But due to various religious reasons, we will sometimes bury an individual. Yes.
Do you have a prescription drug program? Is that in social services?
Yes, it is.
Is that part of the health department, or is that separate?
Currently, it's separate. Although the health department can refer people to us for assistance, and we definitely have a mutually beneficial relationship.
Mm-hmm.
The health department does provide prescriptions, but we provide the ones that they do not provide.
So if folks need health services, it seems like it would be a good idea to come to Community Support Services, and you can be steered to whichever is the appropriate place for you,
absolutely.
Or both. Yeah.
Yes.
Tell me about the foster grandparent program. Now, my staff loves that program because our staff photographer goes out and does the Rockathon fundraiser every year with them and gets some great pictures. But
I love that program too. It is a grant that we get from the federal government, about $400,000, maybe a little more. And it's, to me, I call it an intergenerational benefit. We have seniors, age 55 and older, under 200% of the poverty level, who become volunteers, and they work with children either in the voluntary pre-K program in the public school system or in private daycare centers. And they get a small stipend, so they're getting a little check. Mm-hmm. And they work with the kids, and they really do become foster grandparents. You should hear the wonderful stories that they tell. And they're a lot of fun.
How many do you know how many?
I think we have about 100.
Really?
Yes, roughly 100, yeah.
Well, that makes a major impact.
It does, and not just the Rockathon, but their annual banquet is also a lot of fun. They get awards for the work that they've done, and it is really a great program that the feds still fund.
There has been a great deal of focus and conversation about Grace Marketplace and Dignity Village. And from the county side of the equation, it's the city is the contracted agency for this service, but they certainly get a lot of funding from the county and a lot of input from the county. And this falls under your department as well, I know. The Community Stabilization Program, is that where our involvement is?
Yes. You mentioned that I left Alachua County after 15 years and returned, and I was involved in the 10-year plan to end homelessness. And this is one of the results of the 10-year plan to end homelessness was to develop a one-stop shop. And this is in conjunction with our partners, of course, the City of Gainesville and the nonprofit community. And we are a partial funder. We work with the city and the county split the funding 50-50. Although the city, of course, owns the property, and leases the Dignity Village property.
Right, they made a major capital investment in purchasing that and renovating buildings.
And we staff the oversight board. County staff do that. So that's a significant job because it's an important role that we have. And we have 2 county commissioners on that oversight board who recommend funding, policy, et cetera. And we are very involved with that project.
The CAP program, the Community Agency Partnership Program, the county funds a lot of nonprofits, although funding is probably not the right word, contracts with a number of nonprofit agencies. Can you give us an overview of the CAP program and maybe talk about some of the specifics that are involved?
Sure. In fiscal year 16, the budget is about $1.15 million. And you know, we've always had a partnership with our nonprofit community. County government can't do it all, so it's a public-private partnership. I consider CAP essentially a grant. It's a local grant. And we have an application process. It's called an RFP. We already went through that. There's also a CAP advisory board that's made up of citizens who evaluate the applications and make the funding recommendations to the Board of County Commissioners. The fiscal year 16 funding recommendations will be going to the board very soon. And the board has prioritized several areas of funding, all under anti-poverty. That's the whole goal of the CAP program, is to reduce poverty in our community. And the categories are food, housing, health care, and children's education, and also safety. And so applicants must fall under one of those buckets. And it's a challenging process. We usually have a good 30 plus applicants. And as I said, the advisory board then makes their funding recommendations to the Board of County Commissioners, who makes the final recommendations. And then once the awards are set, we go through the contracting process. And we work closely with our nonprofits to assure that they're meeting their goals and their outcomes and doing a good job on behalf of the county.
It's always a very interesting meeting, and there's always an interesting exchange and back and forth between the commission and the advisory board and the agencies. But I think the point you made about if we weren't hiring nonprofits to do this, we would have to be thinking about doing it ourselves. And these agencies exist. They get great matching funds. There's a lot of leveraging going on, as high as 16 to 1, I think, some of them.
Yes, that is correct. And it is a partnership, and county government can't do it all. And this fund, there's a lot of needs in our community. There's a wide variety of needs, and many of these agencies are focused on one or two areas, and they do a really good job.
We touched on rumor control. The crisis center kind of kicks into action, and they become that. They provide that service for county citizens. But you have other services that you're responsible for in the event of an emergency.
We are responsible for sheltering, mass care and sheltering, and so county staff actually staff the shelters. We work in partnership with the Red Cross, but we are the lead agency. And we staff shelters. We prepare all year long. In the event of a disaster, it is incumbent upon us to take care of our citizens. One thing about Alachua County being in the center of the state, we also serve as a host agency. So if there are storms on the coasts or down south and people need a place to go and the state authorizes it, we open our doors, and so we staff that as well. And
that's no small job.
No, it's a year-round activity in terms of planning, yes.
I remember you were there in 2004.
Yes, I was.
That was my first year on the job.
4 hurricanes.
Yeah.
In 1 year.
Now, I wanted to go back a little bit, because at the start of our conversation, you mentioned your budget was about $13 million. But I thought that we could clarify that a little bit. A great deal of that is funding that you have no control over, or really even the county commission has no control over.
That is correct.
Things like Medicaid. How big a chunk is Medicaid out of that?
Medicaid is about $4.5 million. And then we also have some other mandates. One is the medical examiner's office. That's $860,000. We also have, well, we already talked about indigent burials. We also are required to pay for child protection team exams. That's when a child is alleged abused. We pay for the exam, and that's about $120,000. So of our $13 million budget, about $11.5 million of that is general fund. About $5 million of that is mandates. Another almost $3 million goes to our outside agencies, such as Meridian Behavioral Health. We give them about $600,000 of general fund and another $200,000 out of choices.
And for those that don't know about Meridian, what service do they provide?
Meridian is the behavioral health entity in this community, the largest one, where they provide mental health and substance abuse services, the crisis stabilization unit, detox, and in the state statute it requires a 75 to 25% local match.
Right.
And so that's another, it's a mandate to a certain extent. So of that $13.5 million, less than $3 million operates our department, the programs that we've been describing.
Now, the Choices program, that tax ended back in 2012, I guess, but that program was administered from Community Support Services, and we're not done with it yet.
No, the Board of County Commissioners created a trust fund and just recently determined the length of time of that trust fund. It's going to be 10 years. And it's about $8.2 million in the trust fund, and if it's spent over 10 years, that comes to about $750,000 a year that's available for spending. And so after some administrative expenses, there's some funding that they provide to behavioral health services, and then there will be about $465,000, that's an estimate, that we just put out an RFP for our safety net healthcare providers. And so they will be applying for those dollars, and we'll be going through a similar process like CAP.
Will that be administered by the CAP program, or is this a whole different kettle of fish? Or?
It's a different kettle of fish in that we will be hiring an administrator for that program who will likely have some healthcare background.
I see. So Susan, we're about out of time, but just in general, what do you see as the major issues that we face, particularly things that affect your department?
I see three, and I'm not going to rank them in any particular order. Homelessness, continues to be a lack of affordable housing for people. Mental health and addiction treatment, there continues to be a lack of funding for adequate treatment to include permanent supportive housing. And then just our changing demographics. We have a large senior population, and I think we're going to be seeing more and more senior issues as we all age, particularly baby boomers, though.
That's us, isn't it?
Yes,
yeah.
It is.
Well, thank you so much.
Thank you, Mark. Thanks so much for having me. I really appreciate it.
We used to write letters to each other a lot, and it was intimidating to talk to him sometimes because he just seemed so isolated by himself.
She started talking about how she wishes that her life was over and she wishes that she was never born.
So I knew he had depression, but I didn't know it was that far.
Said something to me about killing himself.
Tell somebody, tell an adult, a counselor, parent, whatever.
You have to try and help them get help.
You have to take it seriously. You can't assume that they're just saying it because the risk is too great.
It's a hard situation because you do risk making that person very angry and losing their friendship.
It would have been horrible for me if she never talked to me again, but I'd live with it because I know she'd be alive.
Definitely worth getting help, even if you think you're going to lose a friendship, because it's better to lose the friendship than the actual friend.